Hello, everyone. Thanks for joining the call. We have a great panel. I'm Jessica. I think I've met a lot of you over email. I'm leading comms. I just want to remind you, if you have a question, use the Q&A box at the bottom of your panel, and I'll toss it over to Marcus.
I'm going to toss it over to Jenna first, right? Jenna, did you want us to start off?
Sure. Hi, everybody. Welcome. Thanks so much. I see folks are starting to roll in. We really appreciate you making the time to join us here today. We've got a really important conversation amidst so much going on with a lot of, I think, really important content from a range of facets. From this conversation, we're really excited to be joined by our members and our new board member, Karen, for an important conversation. Jessica is going to share in the chat window a link to the Google Sheet that we're using to compile all of the various actions undertaken by folks across the network. And so we encourage you to ensure that you're adding those resources in there. The listservs are great, but we want to make sure we have some central location for all of that content. If it doesn't live on the spreadsheet yet, please create it and let us know how we can support. With that, I'll turn it over to Marcus. Thanks for joining us. Marcus, you're on mute.
Can you hear me now?
Oh, yeah.
Okay. All right. So everybody's been in this conference call hell all week. So thank you all very much for making sure that we are able to join, and glad that folks can hear me. So my name is Marcus Coleman, political partner 2017, also co-director for the DC chapter. A few things as we get this conversation underway. So one, I just want to recognize all of the hard work that everybody's been doing across the networks and across the chapters. I know that some affinity groups and expert groups have already been engaged. I want to also recognize that we all collectively are in a volatile, uncertain, and ambiguous and complex environment, and affirming the belief of those folks that are working on various task forces and various efforts, and also respecting those with humility, that we have some very insurmountable challenges ahead of us in all aspects of our lives. And so we recognize, not just within the network, but of course our friends and family, we have folks that are afraid, looking for a way forward, and really want to make sure, I know for folks on this call, making sure that we're coordinated to help scale our efforts to continue to uphold the four pillars of our organization: defense, diplomacy, development, and democracy engagement, and using those tools and network towards a safer world. So the purpose and intent of this call and the series of conversations we're going to have today are to accomplish kind of three things. Number one, provide a little bit of clarity and context about where we are for those seeking to make meaning of all of the different moving pieces. We continue to be very much in a press release by press release pace of change. Number two, affirm the current communication, coordination, collaboration, and cooperation among the membership. As I've mentioned, we've seen some affinity groups. I know various chapters are engaging in some other ways, but just want to make sure that we're continuing to align among the community, but also in support of HQ. And then number three, pointing the network where we can to communities and activities that you all can get engaged in. And so for folks who have particular skill sets or particular perspectives, but aren't quite sure where you fit, I'm hoping that the conversations and presentations that you're going to hear today help kind of affirm where you can be of best value at this point. And for those who aren't of best value at this point, where we're going to need you going forward. So you're going to hear from several panelists, and I'll introduce each panelist. They'll have about 6 to 8 minutes where they'll give a brief overview. We'll have a very quick Q&A with each one. To Jenna's point and what Jessica mentioned, please input your questions into the chat, and we'll try to incorporate those as we can. And for any outstanding questions you have, if you're at the chapter level, share them with your chapter leaders. If you're at the expert group or affinity group in those areas, make sure that you keep those answers there. We're going to definitely have more questions and answers today, and just want to affirm that we'll try to get to them where we can across the membership. So the first person that I want to introduce is Dr. Rebecca Katz, who is a professor and director for the Center for Global Health and Science and Security, also a health policy advisor to candidate Joe Biden. She's going to address some of the policy recommendations the U.S. should adopt to slow the spread of infection and ease the burden on the healthcare system. Before she presents, everybody in Truman knows how this goes. We're functioning in Chatham House rules, so please feel free to share some of the information, but in a non-attributable manner. If you have any questions about what that looks like, just send a message to the communications team, and we'll help direct you there. But again, this is a very trusted space. I know many of you have been in the community for a long time, but for those newer members, again, just be mindful that we are operating under Chatham House rules for this call. So with that, I will pass it over to Dr. Katz, and then we'll engage in a bit of Q&A. Dr. Katz, did you have any opening remarks that you wanted to provide?
Yeah, thank you, Marcus, and thank you all for organizing this and making the opportunity for us to talk amongst each other. Let me just start with some numbers. And the first briefing I did on the outbreak this morning at 7 a.m. When I pulled the numbers from there, it looks like there's been a 17.5 thousand increase in the number of cases since about 7 this morning. So we are, the cases are spreading around the world. They're now in 163 countries. The number of deaths has now surpassed the number of deaths from the West Africa Ebola outbreak. We're now over 11,000. And I'm just seeing a tweet from Iran where 50 people are contracting the disease every hour, with one person dying every 10 minutes. So disease is spreading pretty rapidly. Italy, Spain, Germany, France, Switzerland, UK. So most of Europe is now about 33% increase every single day. The United States was about at that, but we're seeing an increase with, we're seeing a testing bump. So we saw a 51% increase from yesterday to today. And case fatality rate in the United States still seems to be hovering around 1.4. In Italy, however, the case fatality rate is now over 8%, due to both the demographics, 23% of the population is over the age of 65, as well as the fact that the healthcare systems, particularly in the Lombardy part of the country, were overwhelmed, and hopefully Kamal can speak to this too, but the clinicians there are having to make horrific decisions with a limited number of ICU beds and ventilators. They're literally having to decide who lives and who dies. So it's the situation is certainly getting more complicated. As of this morning, there were almost 800 cases in sub-Saharan Africa, and I think we should expect to see the numbers from Africa and also from South Asia grow significantly. On the other hand, China is now in its second day of 0 indigenous cases, and Korea, Singapore, Hong Kong, Taiwan, to some extent Japan, are all, I wouldn't say totally under control because they're now worrying about second waves, but are showing potential roadmaps. I think the challenge is going to be to try to figure out which of those roadmaps are actually adaptable in an American context. I mean, there's a lot to talk about. We're seeing more social distancing measures put in place by the minute, and a whole bunch of governors doing pressers throughout the day today. But your question about what we should be doing to manage the outbreak, I would break that into, I think the most urgent, but also not necessarily the most tenable, is that we need to test. We don't even know what we're dealing with. And so I think there's an assumption that the amount of people we're testing is probably maybe about 10% of the actual number of cases. But we're flying blind at the moment because we don't know. We have healthcare workers who are putting themselves at incredible risk, who don't have sufficient personal protective equipment. They're in the epicenters throughout the country. The word is that they feel like they're in war zones. But fighting with marbles, not guns. And how do we actually get enough PPE to them? How do we get ventilators out? How do we actually create hospital capacity? And then how do we create the workforce to take care of the numbers that we're sure that we're going to surge? We have the social distancing measures that are slowly being put in place. I think we're going to have to watch carefully for what those look like and how well different parts of the country actually abide by them, because they can be effective, but they're only effective if people actually do them. And I think one of the challenges is going to be to, there's a lot of laws on the books, and I don't think there's a lot of the language that exists related to social distancing and quarantine and isolation. I don't think much of the American public is quite ready for what enforcement of that looks like. and how that will interact with civil liberties. So I think so figuring out how we do social distancing, how we do it well, and how we possibly do it for a sustained period of time. This is not a 2-week endeavor. I don't think it's a 5-month endeavor, but it's probably a several month endeavor. And then finally, we have to start thinking about what a roadmap looks like. The studies coming out, some of the modeling that's been done and put forward earlier in this week painted a very sobering picture for many decision makers, with this feeling that, if you don't maintain aggressive social distancing measures for up to 18 months, you don't have a chance. And I think that there's a little bit I think there's a nuanced way to address that. And I think one of the things we have to be looking at is how to move from, I guess, a model of suppression where you have mass social distancing to a situation where if you have robust testing, and you could follow much more of the South Korea model, where you test aggressively, you isolate, you quarantine the concentric circles, and then you implement pretty invasive contact tracing measures in order to kind of reintroduce people to society. I think we're able to do that, but it also will probably need to be matched with the ability to do serologic testing, so we can figure out who has what level of immunity. And if we can, I have not seen anything definitive yet to say what type of immunity one gets after recovering from the disease. But I think everything we know about immunology says that there'll be some level of immunity. I don't know how long it'll last, but we're going to need to be able to measure it, because if we can identify that, then you can think about a future period of time where people are able, maybe not entire swaths of the population, but enough of the population is able to kind of re-enter society and keep the economy and social life going. So all of that to say that, like, I think there is a roadmap. I think there's also a lot of challenges we're going to have to figure out about how we adapt the Chinese model to an American context. But there are plans being put in place, and now we just kind of have to figure out how that gets modeled and what maybe some of the triggers are as we match that with the science. So I'll stop there for now.
Thank you very much, Dr. Katz. I think you just put every expert group to work in some form or fashion on a few things. So I think, number one of the big things that I heard you saying is that one of the things that's going to be incredibly important is that we have clear, consistent, and concise and accessible communications, right? So we know that people are processing and consuming a lot of this information, both from a personal but also a policymaker perspective, at a very rapid pace. And so to the extent that we can have maybe our fellows or those folks in the political partner space really think about what methods or tactics can we engage from a risk communications frame to make sure that we're affirming where we can, validating some of that guidance that we know that works, but then also be mindful that there's going to be some implications down the line. And here I want to go back to fellows in DEF CON, where we have a lot of folks that are helping to at least inform and influence some of the questions happening both in various spheres of government, but then also in some of the non-government spaces. And so communications was one key theme. I think the second thing that you touched on that we can definitely look to our Homeland Security and Community Resilience expert group on is that there's going to be some very big questions in the policy space on efforts ranging from privacy to other Homeland Security and Community Resilience issues. And so to the extent that we're able to kind of gather among that particular expert group and get some key questions fleshed out and shared among the network, that may also help kind of feed into this broader conversation that I know many members on the phone are having, and just want to take some time to thank the 121 folks that are on the call right now. So thank you very much, Dr. Katz. If you have any additional questions for her, please drop a question in the chat box as we mentioned, and we're going to actually transition over. Dr. Katz talked a little bit about some of the domestic and global economic impacts. I'm going to transition it over to Ms. Karen Karniol-Tambour, board director, so I might have butchered her name, and my apologies for that. Karen, are you okay to chime in and talk to us a little bit about the COVID-19 impacts from a domestic and global markets perspective?
Absolutely. Don't worry about the name. It's difficult, and a lot of people call me Karen KT. But hi, everybody. As John said, I'm both a new board member and head of investment research at Bridgewater Associates, which is a large financial firm. And the things I was going to talk about is, first of all, just having in perspective how big of an economic hit this is shaping up to be. We have places like China who are ahead of us on the curve, to give an example of just what that's like and what we're walking into. And it's important when we look at that to remember that the US is pretty far behind China. They had pretty significant quarantines earlier into the case of very rapid growth in the disease. And they really had one center early on. The United States has, multiple states that have a pretty high number, even though the most significant area is in New York, and it's somewhat behind in setting up any real degree of social distancing and quarantining. Our assessment is that in the United States, you're looking at numbers that we haven't seen in decades, and probably worse than the financial crisis in terms of that initial hit of how far the economy is going to fall. You'll probably see quarter-over-quarter numbers being, in the numbers like -15 or -20. And the big question is, what will it be like to come out of that? Because in the heat of the moment, kind of the peak of the event, which probably is going to last something like 3 months, and that's a pretty optimistic one, because in China, the peak kind of quarantining was about 2 months. And so it'll definitely take us longer than China to come out of it based on starting later. So you had more time for community spread ahead of it. That's the peak. And in that peak, what basically happens from an economic perspective is you're forcing a shutdown. So a whole lot of businesses just don't have any revenue coming in and still have all the same debts and so on. And so you need a coordinated way for every time someone spends, it's someone else's income. And now every business basically can't pay its rent, can't pay its mortgage, and that kind of cascades through the economy. All that relates to what government needs to do to help us come out of this at the other end. And what's very, very unique about this time is that you haven't had a time since the 1930s, 1940s, World War II period, where the only effective way to have policy is for both monetary policy and fiscal policy to work together. And basically, if you look at the Federal Reserve just went through the financial crisis 10 years ago. So it kind of knows its tools and it's throwing everything at it. And so as you start getting illiquidity in the markets and problems with trading and the questions of can banks survive, the Federal Reserve is all over it, printing lots of money, getting in there, and they have all the pipes open to sort of get the money to the people who need it in the financial sector. And I think they're pretty capable of making sure the financial sector stays strong through this. The problem is there's a big limitation to what they can do. They can't drop interest rates anymore. They're already at zero. And by nature of what a Federal Reserve does, it can't really get the money to people who actually need it. Somebody who lost their job, can't pay their mortgage, can't pay their rent. And that's where you absolutely have to have fiscal policy step in. And what's so important right now is to be advocating for fiscal policy that will be smart in targeting who actually needs the money. And that comes on one hand in terms of not having kind of stupid, broad tax cut type policies that wouldn't directly affect the people who are being affected. Most importantly, getting people who are losing their jobs, businesses that are shutting down, and making sure the businesses that are viable and would be completely fine, especially small businesses like a restaurant, don't just go out of business and can never come back because policy wasn't targeted at them. If we just spend the money indiscriminately and not get at those, it'll be very hard to restart the economy. And on the other hand, fiscal policy is going to need to get involved in issues like, what does it really mean to give a rent holiday or a debt holiday? How does that work? How do we make sure people don't need to pay their mortgages for a little while? These are things that are a lot easier for sort of a China to do on a broad scale. In the US, it's a lot more complicated, a lot more localized, and a lot of debts are even owned by foreigners. So are you going to go tell, pensions in another country that their debts aren't being paid? So government is a very, very, very hard job to do. And what you're seeing is that as government is floating ideas of what it might do, the Federal Reserve is absolutely ahead of it, marching ahead, printing money faster. And it's there to make sure its job is critical because the federal government is going to have to borrow a tremendous amount of money to get ahead of this. The federal government is going to have to open up a tremendous deficit. Some of it will open naturally because people will stop paying taxes, and a lot of it will have to be proactive, getting the money to people who need it sort of policy. And the only way to make that work in this economy is to make sure the Federal Reserve can print money on the other side or have another set of policies like interest rate targeting like they did in the 30s and 40s to make sure that all of that deficit can be financed. The Federal Reserve has thought a lot about this. In January, they put out a big paper saying they're looking specifically at the 30s and 40s and thinking through how to be able to do that again. So they seem ready. The federal government seems a lot less ready and much less having thought through who needs the money, How do we get it to them? And basically, once you're through that 3-month event where lots of people are going to lose their jobs, lots of people are not going to be able to pay their bills, how do you make sure you don't kind of go into a death spiral where the economy can't restart? What you're seeing in China is the positive of that, which is as people are sent back to work, places are reopening. If we don't do those kinds of activities of getting money to those who need it, even businesses that are completely viable will just not be able to reopen. And the Federal Reserve will only be able to do so much with interest rates already at zero. Fiscal policy targeting it at people who need it is going to be absolutely critical.
Thank you very much, Karen. And I think specifically what you're speaking to is I'm thinking about certain expert groups that I'm going to be looking to, and they're probably already thinking about this in an active way. I'll say one is first the trade expert group within Truman, and then again also those fellows that have some connections or maybe actively engaged in various departments ranging from Treasury to the Fed. But then also you mentioned a good point that I think is important for us to consider for political partners and those who are thinking about it from a global perspective, even with some of the other governments from like a diplomacy perspective. What are some of the questions or things that we should be thinking about or learning from in terms of how to transfer massive amounts of money from federal levels or national levels down to locals and states? And for those local elected officials or state elected officials that haven't been through a Stafford Act declaration in years, what does it look like for them to know what tools that they can leverage and pull on? And so, again, if you're in the trade expert group or if you have connections there, I think that's one healthy space to continue this conversation. So I thank you very much for that, and continue to leave your questions in the chat for her as well. We want to make sure that we get through all the presentations in enough time to get over some of the questions throughout themes. So thank you. Next, I want to tee up a Truman member, one of the first Truman members that I met and achieved a really big thing when I first started back in 2017. Also, he's been a face and voice for a lot of efforts. I know he has an op-ed coming out soon. For any Truman members, if you have op-eds or things that you're working on, this is just a friendly reminder to send some of that information out. Dr. Kamal Kalsi wanted to tee you up to talk about what medical professionals are doing and responding, what next steps should be taken, but also pulling in a thread from a conversation that I've seen in the chat. What are some of the mental health implications, or where are you seeing some of the mental health implications, not just for the people that are affected by this, but I think also for those that are supporting the response and responders as well. So if you can kind of paint that broad picture for us, some things that you're seeing and looking at and recommendations you'd have for fellow Truman members, I would greatly appreciate that.
Yeah, thanks, Marcus. Pleasure to be here, and thank you everybody for tuning in. You know, I'm an ER doctor on a good day. Also work in a bunch of urgent cares here in North Jersey and New York. I'm about 30 miles away from the New Rochelle cluster, so it's literally in our backyard. And I personally started getting really concerned about 2 weeks ago, and I sort of detailed some of this in my op-ed, where actually about 3 months ago, I would start asking people, "Hey, have you been to China?" And people would laugh. There was this sort of incredulity about, why are you asking me if I've been abroad? No, of course we haven't been in contact with anybody with coronavirus. Then maybe a month ago, it was really more of a nervous chuckle, and now it's people have stopped laughing, because the threat, they've finally figured out that the threat is real. We are so far behind the curve on preparedness for this. I mean, part of my background is in EMS and disaster medicine. And so when I deployed to Afghanistan, that's part of the work that I did. We made the mass cow plans for our base there in Helmand province, and we, I can tell you, we were never overwhelmed. But this crazy tsunami of infections coming our way, I can guarantee you will overwhelm our system unless we do something drastic. And social distancing is all well and good. It's a cute idea, but it's garbage. It's not going to work, because about 15 to 20% of our population is either too willful, too stupid, or too something to actually go along with it. And it's going to keep us in a point where we will continue trying to stomp this infection out, but that portion of the population is going to continue allowing the infection to spread. So what we really need is quarantine. We need mass coordinated quarantine. And I agree with what you guys have alluded to previously. It's it brings up a lot of questions, and how do you actually do it? What does it look like? And it is most certainly going to be painful. Do you bring out the National Guard for this? Do you send somebody to jail? Are people going to die because of the quarantine? So these are tough questions. I don't have an answer to that, but what I can tell you with clarity is, unless we do a quarantine, a national quarantine, we're going to see a tremendous amount of death. And right now we have an opportunity to sort of put our arms around this thing and still figure it out. We have, and there's some of these figures vary depending on who you talk to, but we have less than 100,000 ventilators in the US right now. Only less than 100,000 ventilators. That's including the national stockpile and military ventilators and a few other sources. What we are projecting, even on a good day, is that we're going to need somewhere between 300,000 and 400,000 ventilators, and it's just, I don't know how you do that in the span of a month. I don't know how you do that in a span of 2 months. So there's going to have to we're going to have to figure something out quickly, or people are going to die. So I'll tell you some just personal stories. Me and my fellow ER physicians saw the CDC guidance that came out yesterday with regards to safety equipment and stuff, and we were really just left scratching our heads, because at the end of it says, well, if you don't have any more safety equipment, then just use a bandana. And it was just like, we're like, you've got to be kidding me. This is like, are we still in the United States? Use a fucking bandana is what we've come down to. So I thought that was not appropriate, and quite frankly, just really aggravating, because those of us that are on the front lines of this thing know that we're going to get infected. I mean, if you look at the data coming out of China, about 15 to 20% of healthcare workers are getting infected, despite the U.S. use of PPE. We have very, very inadequate supply of PPE, and it doesn't look like we have any relief on the horizon for that. So that's one issue. And then there's this other issue of that we've been talking about with the antimalarial drugs, chloroquine and maybe Plaquenil, that was very, very irresponsibly shared as, maybe this is the cure, to coronavirus. And I think it was just very, very premature and irresponsible to say that, because looking at the data coming in from China and Europe, it's not clear to me that it works. And so what they did was they caused a mad rush of people going to their doctors asking for Plaquenil just in case. They caused a mad rush going to their doctors asking for chloroquine, and saying, oh, I got a bit of a cough, I got a bit of a tickle. I heard of a story of a doctor in the Bronx that picked up 60 tablets of chloroquine just in case, and he wrote the prescription to himself. And it was just, is disgusting, but you know, this is going to happen, and this is the type of behavior you're going to see when you have you don't have mindful communication. So I personally don't think chloroquine's really indicated unless people are very, very sick and they're going to need hospitalization. I think you could probably use it in that case, but also they need to consider all the other people with autoimmune diseases that rely on these medications. And now you've caused a national shortage because you can't control your mouth. So I just really am very, very disappointed in our executive branch's response to this whole thing. You know, despite the PPE issue, the ventilator issue, just the communication issue, we just have failed on so many levels. And you know, I've seen some of the bad estimates for what may happen. You know, it ranges anywhere from 2 to 6 million people dying over the course of the next year, and we may be in for the next this may be a 18-month endeavor. So what we should potentially do is do national quarantine, you know, for 3 to 4 weeks at a time, or at the very least a regionalized quarantine for 3 to 4 weeks at a time, and then it should be coupled with the total percentage hospital admissions and ICU admissions. So if you couple it with you know, your ICU bed rate, then whenever the bed rate falls, let's say, I'm just picking an arbitrary number, let's say the ICU bed rate falls below 50%, or the hospital bed availability falls to about 50%, then maybe you can ease up on restrictions, and you know, we can go maybe a month before we have to shut it down again. And we're probably going to have to quarantine you know, 2 or 3 times like that, unless we do one mass quarantine.
Understood. And thank you very much for that somber but candid and authentic viewpoint from where you serve. And thank you again, Dr. Kalsi, and all of those that are working in the healthcare sector and providing services where they can. We got a handful of questions from him, are for him, and I think there's a few folks that jumped on late, so I just want to do a few housekeeping things. Number one, Chatham House rules, again, not attributable. Please don't put my man out there and have him sounding crazy, like we got to support each other. Number two, I think it's very important, something that you mentioned, and an expert group that I haven't mentioned yet, but that may very well relate to getting out good quality information, or at least scanning where information is, the tech policy expert group. So we really need you all to continue to be involved, be engaged, and would love to know from the tech policy expert group, for those that are online, what are you hearing and where are you hearing information? Dr. Kalsi, something that we'll come back to you on toward the end of the call, but just the mental health components. And so SAMHSA, for example, is activated their disaster distress mental health line, but we know that there are a lot of challenges, and I think Dr. Kalsi's kind of talked about it. The healthcare system across the board is absorbing substantial pressure. And so while there's going to be some quick tips and tools that we can get through for people in the meantime, that is definitely something that we continue to monitor. And I know there are members of the Homeland Security community, resilience community, that are very active in that. But also I think that this may be an interesting set of questions for DEF CON as a membership group to kind of think through and make sure that we're just exchanging notes and sharing information, because, again, the solution making for this is going to take some time. I want to transition it over now. We have 2 more presentations, and I want to leave some adequate time for Q&As that we don't get to. But the next one, I think, to kind of what Dr. Kalsi was talking about, is there's a lot of stuff happening on the ground that are definitely creating tensions between that last question that many of us have filled out when we became a Truman member, right? Where's that balance between protecting and preserving human rights and our Constitution and things of that nature, and this call for national security? And one person that reflects many others is very actively thinking about this from an immigration perspective is Ms. Camille Mcclure. So Camille, I want to pass it over to you. She's the Director of Immigration and Legal Policy at New York Immigration. She's also the co-director for the New York chapter, and she'll be talking about COVID-19's impact on vulnerable populations, specifically migrants and immigrants. Camille, over to you.
Yeah, thank you. Thank you, Marcus. And thank you all for joining us. So I want to acknowledge that obviously, first of all, this virus is having a global impact on all of us, and that there are many vulnerable populations that are being particularly affected, particularly impacted in their own ways. Incarcerated individuals, right? Homeless individuals, those who live in shelters, just to name a few. My world is immigration. For those of you who know me, that's all I ever think about, talk about. So that's what I'm going to talk about right now. But I definitely don't want to make it sound like immigrants are the only ones who are a group of vulnerable individuals. But to Dr. Kelsey's comments about the disappointment in the executive branch, it was sort of a little weird to hear that, because I feel like that's where I've been living for the last, a long time, but certainly more than ever the last 3+ years, and how they've handled this in terms of exploiting, frankly, I don't know how else to say it, exploiting this crisis to promote an incredibly hateful, racist agenda, is really actually, I think, things that I could not have imagined. I've been dealing with things I don't think I would have imagined possible 2 weeks ago or 3 years ago. We started dealing with this issue back in December when the news started coming out of China, and all of a sudden there was just phenomenal racism in our communities. Obviously, an issue that we've been dealing with for a long time, because that kind of rhetoric comes directly from the top, directly from the White House at this point. I mean, our Asian communities really starting suffering. Here in New York, the mayor went out to one of our Chinatowns in New York City, but across, we were hearing stories of kids being bullied in school, of individuals like sneezing, individuals of Asian descent sneezing in the street and being abused by just sort of people, passerbys. And then obviously it's escalated. And in the last couple of weeks, it's just become, as the magnitude of the crisis has really hit this country, it's really become tenfold for immigration communities. I mean, the amount of advocacy that it takes for this government to do the right thing towards immigrant communities is insane. It's unbelievable. And it took all of us from across the country so much effort and so much time just to do simple things like shut down immigration courts. I mean, in New York City, in New York State, we have 130,000 cases in front of our immigration courts. If you walk into immigration court on any given day, it's like riding a subway car at rush hour. It's so packed. You have to be in the courtroom. People are sitting on top of each other. Children are there. Many times children are the actual subject of the case on their own. But other times they're there with their parents, things like that. It took an enormous effort to get them to shut down the hearings. But then they didn't tell anyone. They put it on Twitter, they put it on Facebook. They didn't translate it even into Spanish. The immigration courts are part of the Department of Justice. Even as the Immigration Judges Union was putting pressure, the union that represents ICE employees, because ICE acts as prosecutor in immigration courts, and hundreds of people showed up in court on Monday who did not have hearings. Hundreds of people got on the subway, walked down the streets, did everything that we're being told not to do right now, because if you don't show up to immigration court, you're being deported. You will be ordered deported if you were supposed to be there and didn't come. People who did actually have hearings showed up, but the judges had called out sick. There was no information. Eventually, finally, they did shut down all non-detained cases. We have about 55,000 people on any given night who are being detained by Immigration Customs Enforcement. They're refusing to release them. They're not only are they continuing their regular enforcement, despite any announcement that they've made here in New York City, where they always, they like to use us as an example because we're a quote unquote sanctuary city. They're still going out, arresting individuals, arresting them, close enough to hospitals that people are really afraid of going to seek medical care. Immigrants are afraid of seeking medical care for other reasons too. The government has really clamped down on individuals who use public assistance, and so they're afraid that if they use public health benefits or public health systems, they could be ordered deported or denied benefits. So that's sort of the local, really on the ground impact. The detention centers are at imminent risk of massive outbreaks. We have 4 jails here downstate in New York City, and then 1 ICE-run facility in upstate New York. But then, of course, there's these big, massive private facilities all around the country. We already know that in many of them, there have been positive tests, or people who are, who clearly seem to have the symptoms of this virus, either detainees or individuals who work there. ICE is not releasing any information. But we've dealt with this in the past. We've dealt with this with mumps and chickenpox and tuberculosis. And given how contagious this virus appears and how they've just crammed, 1,000 people into a facility in Aurora, Colorado, or another one in Adams, Mississippi, we know that this is absolutely about to happen. They just took about half of the population in the downstate New York area jails and transferred them to the upstate facility. So the upstate facility, which was actually at about half capacity, is probably at capacity at this point. And then, of course, we have, the automatic reaction, which was shut down the borders. And in some ways that could make sense, right? And in a virus that is spreading so much, that there are, it seems, based on what public health officials are saying and others, that there may be reasons to try to contain the spread of this virus by adopting these kinds of border measures. Obviously, this administration has zero trust on this issue because travel bans, were one of their first signature moves. But then they also are attempting to repeat steps that they actually already took. They just recently shut down the southern border to asylum seekers, regardless of manner of entry, which is something a court within the last year found illegal. The administration tried to do it once, and now they're doing it again using this COVID crisis as an excuse. But they are continuing with enforcement. They are making it completely impossible for individuals who have hearings to know, or for interviews in front of USCIS to know whether or not those are happening. But even if you know that they're no longer happening, they're not extending deadlines. A lot, for example, asylum, you have to file within 1 year of arriving in this country. You have, for those of you who don't know, you're not entitled to a lawyer in immigration, at least not one paid for by the government if you can't afford one. And so in New York, we're lucky we have a lot of public funding to support these kinds of information streams that can get out to our communities. But in other parts of the country, that's not true. And in the detention centers, like I said, that's a real breed. There's just so many breeding grounds that are so directly tied to immigrants. And of course, immigrants, the last thing I'll say is, tend to not work in the kinds of jobs that you can stay at home. So they're really going to face the brunt, of the economic downturn without any ability to get any of the mitigating relief that may come down the road. But immigrants own small businesses, they own homes, they pay taxes, and they really do the kinds of jobs that make our agriculture keep running, our industry keep running, our cities keep running. And the last thing I want to say is I really appreciate the comment about mental health on medical professionals and first responders. I'm an immigration lawyer. I've never thought of myself as a first responder before, but I was on a conference call with 80 lawyers the other day, and by the end of it, half of them were just sobbing and in tears because they're just faced with this wall of hatred and this wall of just, a government administration that is trying to do everything possible to harm the people that they care about and that they've been fighting for years. And I really fear for the mental health and well-being of our communities, of course, but also of those who work with them. Thank you.
Absolutely. Thank you very much, Camille. And just to get some key themes out that you kind of spoke to, there's definitely a major challenge as it relates to the proportionality, right? So the proportionality of the response, but then also making sure that we are transparent for some of the updates that may be affecting those that are affected by the immigration system and the different criminal legal systems at play at this juncture. Intersectionality. So I appreciate you for lifting up, and I want to lift up as well that there's a lot of names and voices, not even on this call, that can equally provide us that deep dive. So I thank you for kind of elevating that and just making sure that we give mention to those who may or may not be represented on this call. And I think the last piece is allyship and how important that is, not just for ourselves in the network, but for also other allied organizations that we work with. So we know that Truman is not going to be the clearinghouse for every single thing, but this is a place and space where we can have some of these candid conversations and continue to be better allies in the organizations and spaces that we serve as well as partners. The expert group, or the group that I want to make sure that I call out here, is making sure that we continue to support those and coordinate across the True Diversity Affinity expert group. But then also, again, for those political partners, we have some wicked challenges ahead of us with some of the framing politically that's going to be coming out of not just what happens when we implement national quarantine, but as things begin to find its new normal, making sure that we are implementing and protecting and preserving those human rights things where we can. So the last speaker that I want to transition to, thank you very much, Camille, is Stone Conroy. So we are at 2:45. We are going to do everything in our power to end on time, but I want to make sure that he was able to get at least his 6 to 8 minutes to kind of give his overview. Again, for any questions that you all have, please leave those questions in the Q&A chat box. And for questions that we aren't able to get to on the call, I think that's going to definitely feed and inform kind of some of the next steps going forward. I want you to also drop questions for the broader group. I've seen somebody drop a potential funding opportunity for folks in the technology sector. So if you know of any resources that are coming up as a result of this that are available for the network, definitely continue to drop those in the question box and use the email chats as well. So Stone, I'll pass it over to you.
Okay, thanks, Marcus, and sorry for the blank screen, everyone. You'll just have to imagine what I look like if you don't know me already. I'm trying to save some bandwidth over here. So I'll go quickly because I know time is of the essence here, and talk a little bit about what I normally do for United Airlines. So I'm a geopolitical intelligence analyst. So I've been looking at what's happening in the COVID space since the very beginning in consultation with some of my private sector intelligence colleagues working in China and working elsewhere in Asia, who were the first to see this, and through a group chat that we all have flagged this for us in the US, saying, hey, FYI, for businesses not feeling the immediate impacts of this, I think this is going to be coming down the pike for you. And so we've been in the business sphere watching this very closely. And I would say the early days for us at United were 100% focused on China, and the general thinking among the security team at United and the emergency response business continuity team was that this was isolated there. We could mitigate our concerns from a business standpoint. We could help our employees operating in China and in Asia. And then as it grew, there was a growing realization that this was obviously not a containable situation. And as you all know, if you're reading the news at all about this, the airline industry is in absolute crisis. Obviously, a lot of people have lost their jobs in the last couple of weeks. So we're not alone in that respect, but the entire industry is poised to collapse unless we can figure out a way out of this. So it's been a difficult few months. I've been busier than ever. One of the main things that we're doing now is just trying to track what's happening around the world from a compliance standpoint. So every time a new country decides to shut their borders or increases their quarantine measures, we have to be responsive to that as soon as possible, because we're still flying as of today to a lot of places overseas. That will stop in the near future. We haven't made a public announcement about that, but similar to other airlines, we have been rapidly pulling down our flights around the world. So every time a new country comes up with a new restriction, I'm monitoring that. One of the things that I'm also doing now, working in conjunction with our 24/7 desk, is looking at all new cases of corona positive passengers and employees that come through the pipeline. So I'm seeing every single passenger and employee who has tested positive for corona, and we're tracking that. We're doing contact tracing. I'm receiving letters from the CDC to release manifests on flights where we have a confirmed person who has coronavirus. So there's been obviously a lot of work around that. In the early days of this, there's a CNN article that I would point folks to, if you haven't seen it already, about the clashes between the Trump administration and the airlines as a whole. And I can't speak to everything in that article. It wouldn't be a good idea for me to, but I will say this. If you've read the article or if you're about to go read it, I will not disagree with anything that the reporters said. And I'll summarize some of the main points. Essentially, there were a series of phone calls between all the airlines last month with the CDC, HHS, CBP, White House, everyone touching aviation security back, it seems like years ago, but just a month ago, when the thought was we could prevent people from coming into the US who had coronavirus through intense contact tracing. That obviously didn't work. I was on a lot of these phone calls with the CDC, HHS, and others, and one of our concerns at the time, which touches on national security, is that they wanted us to collect information from passengers that was above and beyond what we normally do. And they said it was for contact tracing, which absolutely makes sense. It made sense at the time, but we suspected in industry that there were some other ulterior motives for that. And there were some legal issues that we were concerned with, and the tone of the call was very acrimonious. There was a lot of there was feedback from the government partners on those calls that's reflected in the article that the airlines weren't doing enough, that we could do more, that we would be fined, we would be facing civil and criminal penalties if we didn't transmit this information, which we wanted to do, obviously, for contact tracing purposes, but there were some other issues that we were dealing with there. That has all gone away in recent days, and what we're dealing with now is trying to figure out how we can reallocate our planes for humanitarian and rescue efforts. So I know this conversation has taken place on Truman listservs, but we're actually in the process right now of pulling some U.S. Embassy employees and Peace Corps workers out of one of the countries where all commercial operations have stopped. The plane is currently on the ground and should be taking off shortly. So we're getting a lot of requests from U.S. embassies around the world to do those sorts of missions, and we're running them as quickly as we can. We also run a lot of military charters. Some of that has sped up in recent days and weeks. Some of it has slowed down as the DoD tries to figure out where they want people, where they don't want flights to be happening, where they do want flights to be happening. So I'm doing a lot of work on that front. And then also just liaising with regional security officers in embassies and consulates around the world, trying to get a sense of what's happening on the ground. Another thing that we've been working on at United is cyber threats. So that was mentioned earlier in a call or in one of the emails, I can't remember which now. We in the private sector are very cautious of this, especially since everyone has moved to work from home. There's been a huge increase in the number of fake CDC emails, phishing emails. There's been an increase in counterfeit equipment. So one of the things we're trying to do as a company that operates still to some places around the world and has 100,000 employees is to procure massive amounts of equipment. We just had an order of 3 million N95 masks on their way from China diverted by the U.S. government. So we're no longer getting those masks. Hopefully, the U.S. government is putting them to good use and not bad use. But these are the sort of numbers that we're looking at when we order Sandy wipes or anything like that. They are in the tens of millions because that's what we need for our current operations. So dealing with all sorts of things connected to that. One of the other issue areas that I'm keeping a close eye on is the security aspect of this. One of the things that I flagged for senior leadership in the early days of this, at least early days for us in late January, was the potential for our flight attendants in China and in Asia in general to be the victims of assault. As I was looking around the world at places where COVID was popping up in those early days, I was seeing, as all of us are seeing now, incidents of people being assaulted, being in some way treated in a derogatory fashion because of their nationality, their ethnicity. So that's something that I flagged for leadership early on. And we're seeing a lot of that happen now. In New York City, there were 2 attacks on folks in New York City. There was just an attack in London on someone. There was someone who was just arrested in New York for threatening to blow up the office building where the coronavirus testing command post is held. There's anti-foreigner sentiment in South Africa and Ethiopia. The U.S. Embassy actually released a security alert about that in Ethiopia. Protests in South Korea, protests in Israel. So there's a lot of things to follow here on that front. One of the things that we're doing in the private sector is to try to figure out communications. And if you haven't seen it yet, there's a really great study that was released by Edelman in the last couple of days on the reliability of communication around COVID. And one of the key findings was that the most credible source for a lot of people was their employer. So that's something we're really taking to heart in the private sector, and in particular here at United, is to figure out how best to communicate with our employees. There's also, according to this study, an expectation from a lot of people that government and business team up on this. So we're looking very closely to figure out how we can work productively with the U.S. government to combat this. And one of the other key findings of this study was that there's a high expectation of business to act. So that's something that we're looking at closely as well. Long-term planning, I personally think that, this is not from the business standpoint, there still seems to be within my company, and I think within others, this expectation that this will be over in a few months and then it's business as usual. I don't think that's the case. I think the aviation industry in particular will be, if not forever changed, then changed in a dramatic way for years to come. I think in general, businesses have not done enough to do long-term planning. I'm only seeing these conversations pop up among business continuity and emergency management professionals now, because most of us have been completely swamped with the short-term issues at hand. So I think there's a lot of reckoning in the business sphere about what this looks like in the next 6 months to a year.
Stone, thank you very much for leaving us there and for sharing information as you were able. Very somber conversation there too, but also good to know that at this point, at least the business continuity community is continuing to push for communications. In the chat, I did drop the Edelman report that Stone referenced if you want to take a look at that. Also just want to uplift for those that are still on the call, the Google Doc that we definitely need folks to fill out. So we actually are going to be having an entire Truman meeting for those folks who were going to present at South by Southwest on disinformation. They're going to be doing their presentation next week on March 24th at 12 p.m. Eastern, so keep a lookout for that. I just want to close with a few closing action items for those of you that are on the call before I transition over to Jenna to formally close us out. For those actively responding, again, and everyone on this call, please fill out that Google Sheet and don't be afraid to reach out to HQ or your chapter leaders or expert leads with ideas, questions, and things that you have. We're going to crowdsource the questions that were answered today and try to get those to the right people at the expert group lead level or at the chapter level. For those in global health security and seeking to connect with global health experts, some of our allied organizations, the Women of Color Advancing Peace and Security and Women's in Global Health, are actively compiling a list of expert women who are active in this response, and so we can get leaks out there of the current list, which includes a lot of Truman members, and then nominations, so please feel free to nominate yourself as well. For those seeking to be of best help, so many of you are familiar with the work of Team Rubicon or maybe part of Team Rubicon actively. They have a wonderful Neighbors Helping Neighbors initiative that they put a call out on, and so I just want to point folks there for an organization that is active in disasters of all types year-round, but also has done the national call to action with some specific steps to get plugged in on Neighbor Helping Neighbor initiatives. And then there's been a lot of calls for people considering being blood donors to the American Red Cross. As you all can imagine, with all of the pressures that are underway on the medical system, there's a lot of requests and donations for blood that are still going to be needed. It's a Truman's with a platform to communicate. I want to definitely stress that you stay in consistent communication with the Truman HQ comms team. In the event that you have media pieces or you're getting placed already, are there things that are happening and you just want folks to be aware, that visibility is going to be critically important. So if you can put your information in the Google Doc, but then also make sure that you can let us know what angles that you're hearing or stories or questions that you're getting asked about. And if you're getting placed, again, share those articles with us. For those seeking to get active in their network, so the True Lawyers Expert Group, our affinity group, got together this past Wednesday, thanks to Xander. And so I'm sure they're going to be off to the races on continuing to convene around a lot of issues that the lawyers are working on. Email the membership email address if you want to get connected with that group, and also send an email over to, I think Rakia manages that affinity group, but I don't want to put her out there too much more than I already have. And if you're a partner, DEF CON fellow, wherever you're organizing, we want to make sure everybody has information, helpful information, questions, sources to grants, sources to other resources, reports, curating a lot of information that you need. And for those elected officials or those actively running for an elected position or supporting an elected official, we need your ground truth. And so to the extent that you can share with your chapter lead some of the things that are happening within your council or state legislator, or some of the questions that you have, I think getting that information to the chapter leads will help all of the chapter leaders make sure that we're curating and funneling that information up appropriately. And then, of course, we want folks to be activating and engaging with each other across the community. We know that that is happening. As I mentioned, I shouted out a lot of expert groups. I think every expert group, every affinity group has a role to play as we continue to move on with this response. With that, we are at 3 o'clock. Thank you very much. I want to transition it over to Jenna to close us out and give a big thanks to all of the speakers for all of your expertise and carving some time out to have this call today. Jenna?
Thank you so much, Marcus. I learned so much. I appreciate so many of you sticking with us for this hour for such an important conversation. Big thanks to everybody who joined us to speak. I know everybody's time is really precious. We want to be a resource to the community and to folks in need. Please use the spreadsheet. Join us on Tuesday. Let us know what we're missing and how we can help you coordinate, facilitate, work across chapters. We're here for all of it. And just a note that I hope as we head into this weekend that everybody takes a moment to do something kind for themselves and for those that they love. This is going to be a long haul and we're all here to take care of each other, but sometimes we also need to take a pause and take care of ourselves. So I hope folks can get a little bit of rest and we look forward to continuing this important work. Stay healthy, everybody. Thank you.
Thanks.
Thank you.
Bye.
All right, so I'm going to be the old person. I don't know how to hang up a Zoom.
Take care.
I'll do it for you.